Hello everyone, I'm Ziyong Hall from Penang, Malaysia. I'm going to present an epidemiological project from our group, a population-based prevalence and incidence study of NMOSD among Malays, which is an Austronesian group in Terengganu State, Malaysia. Neuromyelitis optica spectrum disorder, or NMOSD, is more prevalent in certain racial groups. In whites or Caucasians, the prevalence is around 1 in 100,000. In blacks, the prevalence can be up to 10 per 100,000. In Asia, among East Asians, the prevalence is higher at around 3.5 per 100,000. How about the other Asian racial groups? Our study focused on the Austronesians. Austronesians are the predominant inhabitants of Southeast Asia islands and archipelago, as well as the Pacific Islands, including Hawaii. Austronesians also form the indigenous populations of Taiwan and New Zealand, the Maoris. Our population-based study was undertaken to clarify the prevalence of NMOSD among Malays, which is an Austronesian group residing in Peninsular Malaysia. We have chosen Terengganu State in Malaysia to conduct our study. Terengganu State in Malaysia has a population of 1.2 million, where 95% are Malay. The State Hospital NMOSD registry and patient's medical record were reviewed. The 2015 IPND criteria were used for case ascertainment. For results, there was a total of 15 NMOSD patients. All were AQP4 antibody positive and all were Malays. On prevalence day, there were 13 living patients. The prevalence was calculated as 1.09 per 100,000. Over a 7-year period, there were also 13 incident cases, and the annual incidence was calculated as 1.63 per million. Our study in Terengganu, Malaysia, as well as an earlier study in Penang Island, Malaysia, that studied the Malays, has estimated a prevalence of around 1.09 to 1.25. This is generally comparable to the New Zealand Maoris, which is another Austronesian group, which showed a prevalence of 1.5. Taken together, prevalence of NMOSD among Austronesians is lower than that reported among East Asians. Our study also reported for the first time the incidence of NMOSD in an Austronesian population. Genetic and racial factors are potentially implicated in NMOSD pathogenesis. I would like to thank my colleagues and project members, especially Dr. Chi Kyong Wong, who has collected most of the data, and we are also always grateful to Professor Kazuo Fujihara, who has always given us inspiration, guidance, and support. Thank you very much.